The new 14-story Helen DeVos Children's Hospital in downtown Grand Rapids replaces what used to be just a few floors at Spectrum Health Hospital. There are some 208 beds, some private rooms where the parents can stay with their kids, a pediatric emergency room, and an expanded neonatal care unit. The entire hospital from top to bottom cost $286 million.
So what will be different about the care received at this children's hospital compared to what is given at a general acute care hospital? And how is DeVos Children's differentiating itself from the other children's hospitals in Michigan and in nearby states? Joining me right now is the Vice President of Nursing Patient Care at DeVos Children's Hospital, Sherry Schwanzel. Thanks for being with us. I know it's a busy and exciting day. We congratulate you, Sherry.
Thank you so much. We appreciate you being with us all day long.
We have been, and for a few days before and weeks and months, we've been reporting about the beauty, the newness, the child-friendly environment. What I want to ask you tonight is, what is going to be noticeably different about the care?
I think what's different for most of us, and we've talked about it already today, is that it's really a dream come true for so many of us in this community, that we have a facility that matches the clinical care that's gone on for many, many years. It's a place that's all about kids, and all you have to do is walk through the lobby, walk through any of our units, and what you see is kids and families, and we're really celebrating that together today.
Sherry Schwanzel, will all the doctors and the nurses and other staff people be pediatric specialists, all trained in dealing with children?
They absolutely are, and that's not just our clinical staff, but we've really been spending much of the last few months training our support staff and our other staff who help us run this hospital understand what's a little bit different about working with children and families. And so the environment wherever you are is really very kid-friendly and family-centered.
You know, we're all used to being in general acute care hospitals where they'll have a maternity floor, they'll have a heart floor, they'll have a kidney floor. This is so much more than a floor. It's an entire hospital. Up until now, children across this state were going for treatment in Ann Arbor, in Detroit. What is going to get them to come here from the UP, from mid-Michigan, from other states like Illinois or Indiana?
Well, I think what's different now, of course, is that we have the facility. And so what it really helps us do is to showcase what's been sometimes a bit of a hidden gem throughout this part of the state and this part of the region. We actually see kids today from over 70 counties throughout Michigan particularly, and we have great relationships with our partner hospitals really throughout the state. But what this allows us to do is really have that showcase facility that really focuses on and reiterates that we are really committed to caring for kids and children throughout the community. We do, as you mentioned, have tremendous number of specialties from physicians and clinicians, and it's a great place to be.
Because of the establishment of Helen DeVos Children's Hospital, is this hospital attracting specialists who they otherwise may not have attracted because it wasn't a children's hospital?
Yeah, we think it absolutely has. We've had just some great recruitment activity in the last couple of years. And, you know, as somebody new to the community myself, I've been here just a couple years, I have to tell you that the fact that we're building a children's hospital really states and makes a statement about the commitment of this community and this healthcare system to the care of children. And so, you know, like I said, it just really is a great physical reminder of how important it is to care for children in a very special way. And so I think we're absolutely being able to get some recruits from the medical world that you just might not get otherwise if you didn't have this facility and really this level of commitment. And children's specialists are often very rare and hard to find.
Well, that's a tremendous asset for our community. Sherry Schwanzel, Helen DeVos Children's Hospital, thank you so much. Congratulations on opening day. We all wish you much success. Your success will be our community success.
Absolutely. Thank you. Thank you for your support.
You bet.